Okay, so I guess we can't start any discussion without really looking at the groups of people that both provided partnership in terms of funding and recognising them. So this was a project that was really built from a very different base to a lot of major capital projects. So the funding partners for us, we had two Commonwealth deeds. One was actually research based and one was from their health division. We had state government funding, both in terms of the Department of Health, but also in terms of DBI. And so DBI provided funding specifically for the research elements that have formed part of this building. And the other aspect to this is that it was a staged project, so there was a lot of complexities in that space. Importantly, and one of the driving elements that has really shaped this facility is from the very inception, we had a commitment in the fundraising space, which was that Austin would fund $25 million worth of the facility from a philanthropic community base. And so that's really challenged us in terms of setting up the delivery mechanisms to achieve that. I also want to recognise the collaborative effort of all of our key partners in delivering this building. We had amazing collaborative work from all of our consultant teams, and not just within the consultant teams but also the construction team within Leighton's. Leighton's were amazing to deal with, and across the journey they really took on board the vision that we had for this facility, and it also influenced, I think, that the way we collectively worked together, which was always very positive. And even in times where things were difficult to resolve, as all buildings have those spots in time where we have issues, it was very positively driven, and the outcome was always focused on the value that we wanted within the project and within the asset that was delivered. So for those that don't know Austin and that look at the shape and size of organisations through numbers, here are some numbers for you. So we're basically an organisation that has 1,000 beds. We're a public healthcare organisation. We have 3 major campuses. You're obviously on the Austin Health Campus tonight, which is our acute campus and is obviously where the Olivia Newton-John Cancer Centre is being developed. We have 2 other campuses, the Heidelberg Repatriation Campus, which is basically our subacute campus. It's about a kilometre down the road from here. And our Royal Talbot facility, which is our rehabilitation focus. We are challenged by a lot of activity across the sites, particularly on this site. The drivers for ONJ are really looking at our current facility, which is in the centre image there. Heidelberg